All right, let's jump right into this. Today, we're breaking down a text with a really provocative title: Islam, a scientific shield against social and medical decay. Now, this source makes a bold and, you could say, controversial argument about religion's place in society, and we're going to walk through its claims, piece by piece.
Right from the get-go, the source hits you with this really stark declaration. It translates to, "This is the result of atheism and permissiveness." So you can see it immediately sets up its core argument, that a turn away from religious belief is the direct cause of societal problems.
So, let's get to the heart of it. The source claims that when you hear calls to separate religion from daily life, it's not about freedom. Instead, it's a recipe for disaster, leading to disease, depression, and even suicide. It's really framing the whole debate as a choice between two very different paths. Okay, so to build this case, the author first tries to define the problem. This section points to what it calls the harvest of secularism and permissiveness, and it uses the United States as its main example. The text kicks things off with a pretty shocking number, and it says it's from a CDC report. It claims there are 110 million sexually transmitted infections in the US. It frames this as a massive public health crisis. That's nearly a third of the population if you think about it. Now here's a really interesting move. The author uses a quote from a US health official to back up their point. By quoting an expert from inside the very system it's critiquing, the text is trying to add weight to its claims about just how serious this situation is. And then, the source makes this very direct and pretty controversial connection. It links the legalization of gay marriage directly to a rise in syphilis cases. This is presented as a key piece of evidence for its whole argument about the consequences of secular laws. The focus then shifts a bit, from sexual health to mental health. The text brings up a UN statistic that over 700,000 people die by suicide every year. But then it makes this big claim, without really showing any data to back it up, that most of these people are atheists or non-Muslims. And to kind of complete this picture of decay, the text also points to things like alcohol-related deaths and crimes, assault, domestic violence. It presents all of these as more consequences of a society that's drifted away from religious guidance. So, after painting this pretty bleak picture, the source pivots. It's laid out the problem, and now it turns to its proposed solution. In this next section, the author presents Islam as a kind of shield against all these issues.
And this slide just lays it out so clearly, right? It boils the entire argument down to a simple choice: a system of permissiveness on one side versus a system of prohibition on the other, which the source argues is actually a form of protection.
The source then throws out this rhetorical question, and it's designed to make you think along scientific, logical lines. The answer it's pushing for is obvious. Any rational, health-conscious person would, of course, choose prevention over permissiveness. So here's the real kicker. The author is trying to reframe Islamic law. It's not just a set of religious rules for Muslims, but a kind of universal public health system that's designed to protect everyone in society, whether you're a believer or not. All right, in this next part, the author tries to build a bridge between faith and science. The argument here is that Islamic teachings aren't just compatible with modern science, they've actually been proven right by it. This is a huge part of the text's effort to frame its argument in scientific terms. So they bring up this hadith, this prophetic saying. The argument is that this was basically a warning, way ahead of its time, predicting a link between what it calls public immorality and the rise of new diseases.
And then it basically turns to you, the reader, and asks, hey, does this ancient text line up with what you know from science? It specifically points to the emergence of AIDS as its main example of a disease that, our ancestors never knew. Now, to try and back this up, the source drops in this quote from a doctor about hygiene and preventing STDs. It's a super specific claim, and it's worth noting the source doesn't really give us much more context or evidence to go on. And that's the connection the author is making. The whole point is that this modern medical advice sounds a lot like the long-standing Islamic practice of ritual purification, or tahara, which suggests that this religious practice has a real, scientific health benefit. Okay, so we're getting to the end game now. Let's look at how the author wraps this all up. This final section is a summary, and it's a direct appeal to the reader, framing the whole thing as a choice between two completely different ways of life. First up, the author just lists out all these positive virtues that Islam promotes. By asking, are these harmful or beneficial? It's presented as a total no-brainer. Of course these are good for society. And then you get the flip side.
It lists all the things Islam prohibits. And again, by asking that rhetorical question, the source frames getting rid of these things as an obvious, clear-cut benefit for everybody's well-being.
This is where the text gets really direct. It basically calls out the common negative stereotypes people might have about Islam. It contrasts them with the positive moral system it just laid out and asks if maybe people are missing the point.
And this is the final punch. The entire complex argument gets boiled down into this one super loaded question. It's framed as a simple choice between what it calls beneficial Islam and harmful atheism.
And to wrap it all up, the text leaves us with this verse from the Quran. It kind of elevates the whole debate, right? It's not just a social or scientific choice anymore, but a spiritual one, ending the entire piece on a theological note about God and gratitude.